medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimal health. She focuses on evidence-based nutritional therapy for food allergies and in bioidentical hormone replacement. She is a twice published author, a long-standing member of the North American Menopause Society, and a certified menopause practitioner. We are on a mission to empower you with the knowledge and expertise that Dr. Merzell has earned throughout her career. We hope you enjoy and want to thank you for being with us today. Without further ado, here's Dr. Merzell. Enjoy the show.
Today I would like to talk about using hormones if you have not reached menopause yet. This is such an important area and very misunderstood area. I cannot tell you how many patients I've had come in saying, well, I've waited for a year until I could be defined as being in menopause. I've had 9 months of hot flashes, insomnia, fatigue, achiness, joint pain, difficulty thinking. And yet I've finally reached that 1 year mark. We need not be so literal when we're looking at the way that hormones function in our body. And during the perimenopause, which means that you have some menopausal symptoms but have not had no periods for a year. This is just an arbitrary tag of time to give us an idea whether you've stopped ovulating or not. 1 year. You may have stopped ovulating before that, but we won't know until we reach that 1 year level. But should women who have not reached a definition, so we know for sure that they are in menopause, should they be treated at all with hormone therapy? Well, here's how I look at things. If your patient is suffering from a variety of symptoms that you can treat with a safe, relatively safe, about, on the high side of safety, natural hormone to support their function, would you stand there and let them suffer so that you could reach a 1 year mark of time? Of course not. This is just absolutely ridiculous to even ask. So let's talk about how women can be helped if they're in perimenopause but not menopause. So what perimenopause would be is when a woman starts skipping periods, starts having irregular periods, and maybe starts having some symptoms that you would see in menopause. Now, menopause is a state of estrogen deficiency. Estrogen has functions all over the body. There are receptors everywhere. So when estrogen levels start to drop, you're going to find some problems, and you're going to find them pretty quickly. In regards to the natural hormones, your liver, if it is functioning well, does a good job of detoxifying and getting rid of estrogen, natural estrogen. So your ovary just is on constant production and maintenance. When it starts to falter and not produce estrogen the way it should, it's not unusual to start seeing problems there. And those problems, as I mentioned before, hot flashes. Sometimes it's not hot flashes. Sometimes it's night sweats. Sometimes just temperature intolerance. I had one patient who just on the back of her neck and upper back would get this creepy, crawly, kind of weird, warm feeling. For her, that was a hot flash. How soon could you relieve symptoms like that if that person had a supportive dose of estrogen. Well, the good news is it could be helped within a few days, probably, if I were to be honest. This is not the type of therapy that takes weeks and weeks to get a certain serum level. That's not the way this goes. If you have estrogen, particularly the natural, which is bioidentical estrogen, it will work right away. And receptors will be filled, things will function better. End of story. I'd like to talk about what happens physiologically in your system when women start being unable to produce enough estrogen for ovulation, which produces the cyclical sufficiency in estrogen that we are accustomed to. Well, at the beginning of the cycle, your body sends signals from the pituitary to the ovary. The ovary starts producing estrogen. If it's getting kind of worn out, it does the best it can, and it'll produce estrogen for a while, and then it'll kind of drop off. And then it'll start producing estrogen because the pituitary is not going to let go of it. It's going to keep hammering on and say, hey, give me more estrogen. So it's going to try again, and then it's going to kind of drop off. And these ups and downs will occur in perimenopause. Now, I liken this to a car running out of gas. If you've ever driven in such a vehicle, you will notice it kind of surges as some gas gets into the motor, and then it kind of, just falls off and then surges again. That's what happens in your body when your ovaries start not producing at the levels that they are healthy levels. So the surges in estrogen really aren't that big of a deal. Your body, likes estrogen. That's not the big deal. What the big deal is the fall. When you drop estrogen, that is what causes these various symptoms of discomfort. So sometimes when women are in perimenopause, if they're given a small supportive dose of estrogen, what happens is the ovary starts producing estrogen. It's like going up a hill. I don't think I can make it. And that little supportive dose just says, I'm going to hang on to you and give you a little push. So that little push, okay, I can keep making some. And it may actually push it to not only not dip and produce the symptoms of deficiency, but it may actually produce it to start achieving ovulation again, which means that regular cycles may start occurring. And when that happens, the good thing is you resolve the deficiency symptoms of hot flashes, difficulty thinking, all this other things. And your periods should start coming back. As the ovary continues to deteriorate, however, you'll start skipping and you'll need to increase the estrogen. And this is a way of gently modifying to help women into this transition of menopause. Waiting to give women therapy until they have reached the textbook definition is just not appropriate in healthcare. Now, I want to tell you one other little nugget of information while we're talking about this. When the estrogen decreases, the major hormone that starts hammering on the ovary is follicle stimulating hormone. So this starts surging to hammer on the ovary to produce estrogen, which it may not be doing very well. When that FSH rises, there are cells within your bones called osteoclasts and they start breaking down bones. So if you wait for a couple of years before you start taking hormone replacement therapy, you're going to get these surges of follicle stimulating hormones that are going to be stimulating bone breakdown. As soon as that goes up, there's actual receptors for the FSH on the osteoclasts in your bone. This is why when women start going through perimenopause and the early part of menopause, they do start losing a lot of bone. This is the mechanism. I'm going to try and make these short and sweet, so I'm going to stop here, but stay tuned for more.
Thank you so much for listening. If you enjoyed today's content, please feel free to share with a friend and help us spread our message. If you'd like to learn more about Dr. Marzell, please visit our website at www.drmarzell.com. Until next time.